Hey, Dr. Tam, is keto diet the best diet for weight loss? Let's jump in and debunk a few things now that we have a good foundation and understanding of what the ketogenic diet is. I want to first thank you all again for being here today and joining me on this segment. So I'm hoping this segment will be of interest because I feel like a lot of our Mighty Health members are very curious about the ketogenic diet. So my goal is to really debunk a lot of questions regarding that and really just lay a good foundation as to what it really means. Okay, so I look forward to all the questions you may have for me, and I'll definitely do my best to answer all of them at the end, okay? All right, so let's first jump in and start by laying the foundation for what the keto diet is, what it was created for, and really like how it can benefit you potentially. So first we'll start with a little history lesson, okay? So the ketogenic diet was actually developed in the 1920s. It was developed actually by a neurologist by the name of Russell Wilder. And it was initially developed for the management of refractory seizures in pediatric patients. It was thought that by starving the body in this way to bring about ketosis, this was able to actually help the brain stop from having as many seizures. And surprisingly, there was shown some clinical efficacies. However, now as we know, keto diet has become more of a fad and it's become more about weight loss. So I think a lot of people didn't know the history of it. And I thought it was interesting to share. And it was definitely something new for me to learn as well too. So now that we got the history lesson out of the way, let's break down what exactly is the ketogenic diet, okay? I'm gonna get a little bit scientific here. So I hope you guys will stay with me, and I also hope I don't bore you all. So let's start with, what exactly is it by definition? So it's important to note that there are so many different variations of keto diets out there. So really the big picture of a ketogenic diet is it's a diet containing actually a very high fats, moderate proteins, and very, very low carbohydrates. So if we want to get very, very specific, per the European Food Safety Authority, if you're on a legit ketogenic diet, you're really only eating a diet that consists of no more than 5 to 10% of carbs of your daily caloric intake. So this really means about anywhere from 20 to 50 grams of carbohydrates a day for you to qualify as a keto diet. So to really give some context, that's like, half a glass of orange juice a day, and that will be all your carbs, or 2 slices of bread. So as you can see, it's really, really not that much, which is why keto diet is so hard to adhere to. So now that we know what a keto diet is, I think it's so important to break down what exactly is happening to our bodies. Because when we know this, I think it'll become easier to decide if this diet is actually right for you. Because certainly I believe that this diet is not right for everyone. So in terms of the mechanism of what we're doing to our bodies when we're on a keto diet. So as you know, we're consuming very, very little carbohydrates every single day. And the main goal of that is to essentially deplete your body of its sugar stores. So when carbohydrates get broken down, it produces glucose. And glucose is the body's preferred choice of energy. And it provides energy to our bodies, it provides energy to our brain. So when we deplete this source, the body has to switch up. The body has to basically recalibrate and find a different way of getting an energy source that they can utilize both by the body and both by the brain. So when our sugar stores are all gone, what are we gonna do? We gotta start breaking down our fats. So we're counting on our liver to actually break down our fatty acids to then create something called ketone bodies. And ketone bodies are essentially the new source or an alternative source to glucose for energy for our brain and our body. All right, so I know that was a lot. So really the big picture, to recap, is we're depleting all our sugar stores, forcing our body to find a new way of getting energy, and that new way is breaking down fats. So as you can imagine, the body has to completely change what it's known to normally do. And there are consequences. So you'll often hear about something called the keto flu. So just like a normal flu that you'll have, talking about fatigue, body aches, headaches, nausea, vomiting, constipation, that can all happen once our body starts transitioning into this keto diet or going into a state of ketosis. It's not forever, but the keto flu can sometimes take a few days or even up to weeks to resolve because the body's adjusting to this new and different type of energy source. All right, so now let's jump in and debunk a few things now that we have a good foundation and understanding of what the ketogenic diet is. So I know so many people have heard of keto because of how effective it is for weight loss. So the question you guys may have for me is, hey, Dr. Tam, is keto diet the best diet for weight loss? And I'll be the first to acknowledge that everyone's situation is different. But I think my answer will be no. And the reason is this. Here at Mighty Health, a member once told me something that always stuck with me. She told me, Eric, when it comes to lifestyle change, I don't think we have to be extreme. We just have to be consistent. And I think that's my problem with the keto diet, is that it is extreme. Reviewing the medical literature, I was really trying to find as many studies as I can, that really shed light on the long-term effects of the keto diet. And the truth is, I couldn't really find any because this diet just isn't sustainable enough for the long term. And my philosophy for lifestyle change is to always focus on sustainability and consistency. In addition, this diet can also particularly be dangerous for older adults. And this is often not spoken upon enough because a lot of the fitness and dieting programs out there are targeted towards younger individuals. So I want to tell you about a specific case of a patient that was actually, on a keto diet for about a year. This person came into the hospital for feeling nausea, vomiting, and subsequently fell and actually broke, an arm. And in this study, this patient was actually on the keto diet for 1 whole year and experienced some positive effects in that they lost 20 pounds, they had a big drop in their blood sugar, but what happened is by doing this diet, they actually pushed their body to the edge and too far into ketosis, which means, the body was getting into a state where it was starving, and not actually getting enough of an energy source. And that led to this individual to develop these symptoms of nausea, vomiting, and subsequently a fall. So, that's something that is not talked about enough, but is a very real reality. So now I know what you may be thinking. You may be saying, hey, Dr. Tam, but I heard the keto diet is good for patients with diabetes and it's good for patients with hypertension. And my answer is there is some truth to that, okay? So as we know, by losing weight, we can substantially lower our blood pressure and our blood sugar. And in that regard, with the keto diet, you can certainly lose weight and achieve these results. All right? But the danger of it is very particular to diabetic patients that are on medications that already lower your blood sugar, such as diabetic patients on insulin. So as you can imagine, on a normal diet that consists of carbs or low carbs, you're using insulin to make sure you're lowering your blood sugar, every meal. However, when you're dealing with, a keto diet, your blood sugar is already very low. So as you can imagine, if you're still taking your normal amount of insulin, you might actually lower your blood sugar too much to the point you can start experiencing symptoms of hypoglycemia or symptoms of low blood sugar. And one of the first symptoms of that is dizziness, loss of balance. And as you can imagine, the catastrophic consequences of that is a fall and leading to a broken hip or a broken arm. So what this means that if you're a diabetic patient, the ketogenic diet can be quite dangerous. So this is one of those situations where I would definitely recommend speaking to your doctors first. So I don't want to just scare you off from the keto diet though. I do want to review some of the beneficial short-term effects of the keto diet. So I took some time to really dig through the literature and also, kind of remind myself of its positive benefits, because I think sometimes, as doctors, we can be too narrow-minded and a little restrictive about what some patients may want to try. So looking at the literature, in 6 months of small cohorts that undergo the ketogenic diet, most patients actually lose weight. They have an increase of their HDL, which is their good cholesterol. They also lower the triglycerides in their blood, but subsequently they also see an increase in their LDL, which is their not so good cholesterol, and generally an increase in their overall cholesterol. And so that, there are these 6 months benefits, but when you extrapolate these studies to 1 year, a lot of these beneficial effects are actually no longer seen at the 12-month mark. So all to say, I think there are certainly some short-term benefits in doing keto, but there really isn't any good long-term studies out there. My Mighty Health family, I thank you so much for just staying with me so far. I hope this information has been insightful, and I hope that this at least provides a better understanding of the keto diet, because I think certainly it's one that's very complex, very popular, but I just want to make sure, we're doing things safely. And at the end of the day, I think what matters to me as a doctor is that you're doing what feels right for your body, but doing it in a safe way. So the truth of the matter is, I think there really is no best diet. I mean, the best diet is the one that we can stick to, obviously. So I guess, like I said before, I think we don't have to be extreme. We just have to be consistent. So let's be consistent together.